Today's video, Robert Liston, the fastest knife in the East End. He'll have your leg amputated quicker than any other doctor. He was known for his impeccable speed, his willingness to try new ideas, and his precision. Well, for the most part. So there's two issues in early surgery. Okay, we have pain and we have infection. Now, pain, when I'm cutting off your leg, we're specifically talking about amputation today. When I'm cutting off your leg, that's very painful. You have to cut through all the flesh, and then you have to saw through the bone. That's very painful, as you can imagine. There's really no getting around that pain either. There's no way to put you to sleep. You can drink a lot of alcohol, but there's still gonna be some pain there, and not everyone has the ability to drink all this alcohol to try to knock themselves out. You just kind of have to go through with it. And infection, they didn't understand germs at this point. This is the early 1800s in Europe. They didn't understand germs. They thought infection was caused by bad air getting into your wound. They're so close in understanding it, but they don't know germs are in that air. So they're not washing their hands and they're not washing their tools. They're going from one surgery to the next. Any disease is being moved around. It's a mess. But one man thinks, I might have a solution for that pain. And his name is Robert Liston. He's known as the fastest knife in the West End. His idea is, I can't stop the pain, but maybe I can speed up the process a little bit. Because at this point, we had young surgeons who their job was to cut a limb off, but they think, I got this, it's gonna be okay. And they cut the flesh open and then they see the bone there and they're told, saw through it. And they're looking and the guy's screaming, of course, and they're thinking, they're getting nervous and they're losing their mind and they're pausing and everything while the guy's screaming the whole time. And he's in pain. There's assistants holding him down. There's straps and things. But there'd be times where that man would break free because the surgeon's taking too long and just run into the streets, leg half amputated. He would, of course, die hours later due to any number of things. But he thought in that moment, anything's better than this. In some points, the surgeons weren't experienced enough and they would get their saw lodged in the guy's bone. Ugh, it's stuck! You're just screwed at that point. The guy's probably gonna die. At this point, 1 in every 4 people getting an amputation done in surgery are dying during the surgery. Those aren't great numbers. It's terrible numbers. So this man thinks, I might have a solution. We gotta go quick. The surgeons who were terrified about that bone, they were given ideas. They were said, go into the woods, find some trees, practice cutting through logs all day long. So when you see that bone, you're desensitized, just on a log. That's what they had to think. But Robert Liston, he wasn't scared. He thought, I need to do this as fast as possible. So he'd walk into the room, there'd be a body out on the table of the gurney, he'd have his assistants hold the man down, and he'd look up into the gallery. And in the gallery is people watching. So like surgeons in training, surgeons already, and some other people. And he'd look up and he'd say, gentlemen, time me. And they'd have their pocket watches out. Click. And as soon as that time started, he'd take the sharp knife and he'd cut all the flesh off. And then there's no time to waste. Knife goes in the mouth. I hold it here because he needs both hands. He'd grab their leg, wherever it's being, if it's under the knee or above. He'd grab with his left hand. And then under half a dozen cha-cha-chas with the saw. Just like butter, he's through their bone. He sets the saw down. He grabs the leg, tosses it into sawdust. That part's over. He ties off the artery. He grabs the tendons, any muscles, makes kind of a stump, sews that whole thing up. And from first incision to cutting off the thread of the stitches, only a couple minutes had passed. It was pure speed. He became famous for this because it's super surgeon. He's amputating people faster than anyone can believe. And because of that, less people are dying during surgery. As I said earlier, in other surgeries around the country and around the world, 1 in 4 chances of you dying just during the surgery. In Robert Liston's practice, 1 in 10. Not great at all by modern standards, but it's way better. So people who thought, oh, I really need to get that leg checked out, they're going to Liston's because they're like, better odds, you know what I mean? So he has people lined up outside of his surgery because he's became famous for this. Less people are dying. It's kind of a quick and easy, it's not easy. You're still getting your leg cut off. It's still very painful, but only for a couple minutes. I mean, how bad can that be? A couple minutes? So people were camping out outside of his surgery like it's a Call of Duty release and it's midnight. I gotta get their physical copy. They're ready for surgery though. They're camping out to have their leg or their arm, something cut off of them. It's pretty ridiculous. So Robert is fast. He's extremely fast. But with that, he has some issues because he's not perfectly precise. When a man comes in and he needs his leg amputated above the knee on the upper thigh, so Robert grabs his upper thigh, kind of his waist area, and then at this point he doesn't have the saw; it'll just be the blade to cut the flesh, and it's very sharp. So he would cut the flesh. He cut it real fast, and of course he opens the leg because his blade's really sharp and he's precise, and he's not really that precise, but he's extremely fast, and that speed. He kind of loses some precision there. And when he cuts, he not only cuts open the leg, but fully severs the man's testicles from his body. It's extremely painful, and I believe the man died shortly after. He wasn't perfect. In the most famous story, maybe possibly apocryphal, that means maybe not fully true, he was so quick his assistant wasn't ready. So he goes to cut into the man's leg, okay? So he's got his blade out. He goes to cut in the man's leg. The assistant's fingers are here. He cuts the man's leg open and cuts the assistant's fingers off too. And the assistant's screaming. He's probably thinking, why are two people screaming? That's not normal. There only should be one guy screaming right now. And there's blood everywhere, and he goes like this. And the blood from the saw gets onto another man standing next to his chest. It's splashed like a Jackson Pollock painting. There's blood on him. It's a mess. The man who was in surgery is going to die. The man assistant who lost some fingers, they were over here in my demonstration, he dies of infection. And the man who got splashed with blood, he thinks it's his own blood. I was just cut on the chest, he thinks. And that man's going to die of shock. It's allegedly the only surgery in history with a 300% mortality rate. One man was being operated on, and it led to 3 people dying. His precision here isn't perfect. His speed is pretty good, though. But he's still 1 in 10, so he's not all that bad. People love him. They're always coming for him. People are going to die in these surgeries. It's kind of a cost of it, and people are kind of open to it, and they expect that. It's not a new thing. One day, he brings in the body. And people think, oh, here we go again. They got their stopwatch out there thinking, he's going to say, time me. But he doesn't. He yells up to them, today we try the Yankee Dodge. And he pulls out a jar. And they're like, what? Like, what's happening here? And the Yankee Dodge, he explains, is the American way. A few months before that, in America, they used what we're going to talk about in that jar to remove a man's tooth. And then that dentist helped another doctor use it to remove a tumor in a man's jaw. What's in that is ether. It's kind of essentially an early anesthetic. He's going to use that today. He's going to make the patient huff it. He's going to pass out kind of almost immediately. And then he's going to put some on a rag, put it over the man's face. And the people in the gallery are like, what? He's unconscious. And then, of course, he does the surgery in record speed, of course. Flips it all around, ties it all up. A couple minutes later, the man wakes up. When are you going to cut my leg off? What are we doing here? And he's looking down, and then he realizes they already cut my leg off. And the people in the gallery are laughing because it's absurd, but also it's worked. The most painful thing they witness all the time to see how fast this man is, how precise he is. They see a man fall asleep, and he doesn't feel any of that pain. This new idea, one of the most famous doctors, Robert Liston, he's accepting it. He's trying it. He popularizes it. So surgeries all around the country and the world are now going to use this ether. It's not perfect, but now people aren't feeling the pain. It's a little noxious. It's going to affect their lungs, but it's also highly flammable. So in some surgeries, we have gas-powered lamps, and the ether is going to get into the air. Kaboom, mainly. Fires. It's kind of a mess, but it is better, okay? Because they aren't feeling the pain, so you're going to risk it if you don't have to feel the pain. But at the same time, Liston is still doing speed surgery, kind of. He's speed running surgeries, but now they're unconscious, so he can and then just turn and do another guy. He's not washing his hands. They don't understand that. He's not washing the blade. It's kind of a mess. A year later, he's going to die of an aneurysm. For that last year, he's going to do a lot of surgeries. They're going to be great. People aren't going to feel anything. It's a pretty great life. And when he dies, hundreds and hundreds of doctors and surgeons come to his funeral to show their respects. He was a highly respected man. He was quick. He tried new things. And his adaptation of ether removes that whole element of pain. But there's still the element of infection. Up in the gallery that first day, he did the experimental surgery with the ether as a young man, Joseph Lister. And he sees that and he thinks, oh, that's amazing. He was afraid. I'm going to have to cut through people's limbs. They're going to be screaming. How can I do this? And he sees pains removed from the situation. And he wants to remove infection. He spends the next 20 years and he's thinking about it. He's trying different things. He can't figure it out until Louis Pasteur publishes his work and explains that there's germs in the air. That's what's causing all this. It's the fact we're unclean. That's why people are getting infections. And Joseph Lister thinks of this idea, and he's like, I need to try something new. I want to be like Robert Liston, kind of like my hero. I want to try new things. And he takes a chemical that they were using to clean the sewers and making the city not smell like sewage the whole time. He takes the form of that chemical, and he rubs it on a boy's leg who recently broke his leg, puts him in a splint, rubs this chemical that he used to clean the sewers. It's antiseptic, rubs it on the boy's leg, puts more on. And a couple weeks later, the boy's walking again. He's used and created pretty much our first antiseptic. He's removed infection as one of the core issues, as one of the biggest issues. At this point, I said 1 in 4 people are dying in regular surgery. Then after Liston, it was 1 in 10 in his surgeries. And then with ether, it even goes lower. But right after surgery, 1 in every 3 people are dying within that first week from infection. You have an antiseptic agent, you're going to revolutionize things. Less people are dying of infection. People still die today of infection because things happen. But it changes the whole game. And that he's influenced in there by Robert Liston. He's there. That's his hero. He wants to try new things. And Joseph Lister, who later Listerine is actually named of, creates our first modern antiseptic. So in today's video, okay, we understand how we removed pain and surgery and pain and infection from amputation surgery and other surgeries. And it's all because of the brilliant mind of Robert Liston to take care of pain, adapting new ideas, and then his influence on the young Joseph Lister to remove infection. I think these are some fun bits. And this has been Fun Bits About. I've been Trent, as you guys all know. You've, of course, been the audience. We're going to do a few things. We're going to like the video if we liked it. There's a subscribe button. We're going to hit the subscribe button. The bell. You'll get notifications. Hit the bell. That's great. We got a comment section. Doodle-doodle-doo. What do you like to see? Hit me some comments. I know some of you were like, dub upload. I see you. I understand. It's a dub upload. I'm the GOAT. It's great. I love to hear it. Give me your comments. Give me your ideas. I don't see many ideas. If you got an idea, maybe you don't know a specific topic. Maybe you want military. Maybe you want more medical. Maybe you want just a folktale. Tell me what you're looking for, and I'll give it to you, okay? Again, I've been Trent. Again, you've been the audience. Have a great day.